we're going to change speeds a bit. So I want to jump forward in time and talk about the application and impact of policing today. So I think we all know by now that modern day policing is deeply inegalitarian in its impacts. Perhaps the most famous example of this is in the war on drugs and the racial and economic biases which are baked into which communities are policed for their drug use. But also, I think that this topic has been covered pretty extensively by others and very well. So, it's a much more common example and we're all by this stage pretty familiar with it. So I'm actually not going to talk about drugs here. Instead, I'm going to focus on 3 areas that are much less discussed in the debate on policing today. And these areas are the policing of mental illness, homelessness, and education. So let's start with mental illness first. This is an area where we have seen an increasing involvement of police response, particularly in recent years in the UK since the onset of austerity. Nowadays, police are regularly expected to act as frontline responders to mental health emergencies. In large part, this is because of the immense pressure on other public services that are traditionally supposed to address mental health, like community mental health teams, hospitals, and the ambulance service. In 2022, for example, Police Scotland dealt with 23,259 mental health incidents, which is almost double what they were dealing with 5 years prior in 2017, when police were involved in 12,775 mental health incidents. Now, why is this so troubling? So looking specifically at Scotland, under the Mental Health Care and Treatment Act Scotland of 2003, police have the power to remove any person to a place of safety who the police officer suspects to have a mental disorder and are in immediate need of treatment. Already, this causes some huge problems. Firstly, a police station is classed under the Act as an acceptable place of safety, meaning essentially that you can just be held in the cells for appearing mentally ill. The guidance for the Act does specify that this should be a last resort, but given the strain on mental health services, I do question how often this seems like a reasonable thing to resort to. How often are police officers, justifiably or not, concluding, well, it's the cells or nowhere? Secondly, and perhaps even more importantly, what in fact qualifies a police officer, and it's not specified that they need to have any specific training in mental health, this can be any officer, what qualifies them to make a diagnosis of a mental disorder? Now, again, you might think I'm just being a bit hysterical here. If there's a guy running around the streets of Glasgow in his underwear waving a knife around, you're probably pretty safe to assume that there's something going on there mentally. You don't need some kind of psychiatric degree to ascertain that. And yeah, that's a good point, right? I'm sure that there is a lot of cases where police officers are making these judgment calls and they're pretty much right on the money. However, we live in a society, right? We didn't just fall out of a coconut tree. We live in the context of all that has come before and all that will come after, yada, 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 which means all of our judgments are in some way influenced by our socialization. Now, an independent review of the Mental Health Act in England, which is substantively similar to the Scottish Act, found that Black people were 4 times more likely to be detained under the Mental Health Act than white people. Similarly, in Scotland, an independent review from 2021 found that people from the lowest socioeconomic brackets were more likely than their more affluent counterparts to be detained under the Mental Health Act. There was also a racial dynamic to this, with Black, Asian, and other ethnic minorities all being more likely to be detained and more likely to be classed as a risk to themselves or others than their white Scottish counterparts. This difference was particularly strong for Black women compared to white Scottish women. And the reason that this is so important is because being classed as a risk to yourself or others allows the state to detain you for much longer. So initially, the police can detain you for 24 hours inside the police station itself. Within those 24 hours, they can have you assessed by a doctor who may decide that you need medical treatment, at which point they can issue an emergency detention certificate, which allows you to be detained in a hospital for a further 72 hours. Under the emergency detention guidance, you should be transferred to a hospital within 72 hours of this assessment, but this means that you can, in theory, be held inside a police station for up to 4 days, having committed no crimes other than being apparently mentally ill before you enter a healthcare establishment, where you will be detained for a further 72 hours from arrival, so like 1 week in total. You may also be reassessed once you enter the hospital to see if a longer treatment period is necessary. Now, quick little thought experiment here. Do you think that being held in a police station involuntarily for 4 days is going to increase or decrease your levels of mental distress? Do you think that you would be arriving at that mental health assessment more or less likely to come across as mentally ill? And again, stressing the point that all of this is pipeline into medical detention is more likely to happen to you in Scotland if you are poor and or an ethnic minority. Now, I'm not saying that, a police response to mental illness is never appropriate. There may be cases where it is, but what I am saying is that in a context wherein mental health services are virtually non-existent, and where they do exist, they are piecemeal, short-term, and shrouded behind incredibly long wait lists. Far from being an exceptional or last resort power of the police, this is becoming an increasingly common route into the mental health system. Both in England and in Scotland, the number of police detentions made under the respective mental health acts has increased significantly since the onset of austerity and continues to rise every year. This may be explained by an underlying rise in mental illness, particularly since the pandemic, where rates of everything from anxiety and depression to psychosis and paranoid schizophrenia are recorded to be on the rise. But even if that is the case, it's still right to question whether increasing police involvement in the mental health response will do anything to address the underlying rates of mental illness. So that's one thing, right? Now, homelessness. So homeless people in the UK and elsewhere are much more likely to come into contact with the police because of the criminalization of homeless-associated behaviours. For example, public urination is criminalised across the UK, and if you're rough sleeping and all the public toilets have been shut down due to lack of public funding, where the fuck else are you going to go? Generally, in the UK, if you are caught urinating by the police, you will be issued with a fine. And if you do not pay your fine, you may be imprisoned. Homelessness has also been criminalised in very explicit ways. In England, both rough sleeping and begging were illegal under the Vagrancy Act of 1824. This was very recently repealed and replaced by the outgoing Conservative government with the 2024 Criminal Justice Bill. But critics of the bill have highlighted that it is not much more sympathetic to homeless people, particularly not to those from traveller communities, and in effect still criminalises rough sleeping and begging.